Okay, you're recording.
Alright, so my business plan, which is going to be titled Addressing the Silent Epidemic. To begin, the objectives included some data collection, which was used for the creation of this business plan, the plan itself, and also connections to leadership and change, and then, of course, our now what. So data collection for the creation of this business plan. This actually stems back to my BSN program here at Damon. I took a community health class and we got to go to a site in the community. And my group, we went to South Park High School. And while we were there, we engaged with the principal, we engaged with a lot of the faculty there. And it was basically through discussion that we had to zone in on a difficulty, a problem that they're having in the school. And so we did that, and then we also went out into the community, we did a windshield survey, which I'll get into. But through our discussions at South Park High School, we found that there are a lot of at-risk students who struggle, they have no outlet, and they inevitably resort to self-harm. So to date, there are limited mental health professionals, clinical counseling services, and social emotional support for students there. So they have a total of 900 students, and there's only one clinical counselor who has a large waiting list. So, if you see in your folders, you have a sheet that says windshield survey tool. So, this is the tool we use to go out into the community. And basically a windshield survey, I don't know if you guys are familiar with that. So they're used to effectively plan services for individuals, families, and the community. And one has to be aware of the resources specific to the community a client resides in. So this allows for the identification of health-related resources and to understand the gaps that exist in services. So, a windshield survey is conducted from the car, or you can do it by walking, to provide a visual overview and to assess the general community needs. And so, this is the tool on the left here, and you can see on the tool basically all the things that are assessed. So you have the physical environment, safety and transportation, education, health and social services, politics and government. You can just see the questions that you would ask going through the survey. And this is what is assessed. So housing, other buildings, faith community, public spaces, health services, parks, signs, the street use, things that you wouldn't actually think to look at, the traffic, the industry, infrastructure, land use, commercial activity. And so, I'm going to show you what that PowerPoint here. This is the assessment I did. My windshield survey was over 67 slides long. We're not going through all 67 slides. But just to show you, I mean, we can go through everything from like the education, you look at the graduation rates, take pictures as you're going through education. Then you're going to look at things like safety. Again, safety, more of the fire stations, the air quality index. You look at transportation, what modes of transportation are used. And then you look at the roads, of course, politics and government. Health and social services is an important aspect of it. What is in the community? Let's see. Again, what resources are available? Counseling, Gateway, Longview, and then they put in their spectrum of health and services. So you're assessing every single aspect of it. Recreation. This is an important one for South Park community. This is what these children have. They have a kiddie park, they have a park with one basketball, and the rest is just benches. That's what these students have within all the miles that they live in. And now you put the mileage down on all of the slides. Yeah, botanical gardens. One of the important ones I want to get to. Communication, economics, breaks all the different aspects down. And this is what they have within 1 mile of their high school.
where the massacre ended up happening?
No, this is South Park.
South Park?
Yeah.
The tops and everything.
So this is also what they have within 1 mile. Pizza, McDonald's, you have the subs. This is all within 1 mile. Yeah.
Mom and pop businesses.
Yes. So, and then you look at the local stores. What other businesses are there? Well, these students have a party supply store. They have a barber shop. They have an insurance agency. They have a gift shop. I mean, this is what they have within 1 mile of them, of their school system. I know I'm looking through these really fast, and then they also have 100 automobile stores.
How many liquor stores?
Yeah, and then so from all that data, you pull out the weaknesses of the community. One, I looked at all like the infrastructure, the roads. I mean, they're all very poor condition, obviously. Other weaknesses of the community. Here we go. So unhealthy eating establishments, all the liquor stores. In the community, I listed all the bars, the fast food, the delis, pizza joints, things like that. Keep going with the weaknesses. This is what, like I said before, what they have. They have 1 basketball court. They have a nice skating rink, 0.8 miles. They have a park with nothing in it. And, yeah. Then you look at the strengths of the community, which was basically all of the stores. And then the hospital systems, obviously. And from that, you would gather a diagnosis of the community. So primary health needs, I talked about poverty being prevalent in the community, which is contributing to the factor. Also, again, they don't have any, equipment or park courts in their parks. Very few programs for the students to engage in. Physical activity-wise, they have band, chorus, fashion design, musical, and that's all they have. And very few recreational facilities. And so that was the windshield survey. Now I'll go back to this one. So what's important about the windshield survey is you look at things that you wouldn't ever look at, right? And from that, I got to, you get to the root of the problem. It's kind of like CPS. You think it's this problem, you need to get to the root of the problem to address it. And you can get a better understanding of what these students have in their community, which really isn't much as to why are they resorting to self-harm? Why are they, going down that path? So this, in your folders, you have the suicide data for the United States. Again, and then, third leading cause of death, ages 10 to 19. And then, also, this is specifically for New York. This is from the American Foundation of Suicide Prevention. So ages 10 to 24, third leading cause of death. And so that brings me to the next part. You also have a sheet in your thing on this. I thought it was important to outline the current suicide prevention policies and laws. Many states have mandated suicide prevention training for school personnel. They adopt a bill titled the Jason Flatt Act. It was first passed in Tennessee in 2007, and basically it requires all educators to complete 2 hours of youth suicide awareness and prevention training each year in order to be licensed to teach in their state. 21 states have now passed this act, and the requirements of the bill do vary by state. New York has not passed it. For New York State, currently suicide prevention training for school personnel is not mandated, it's just encouraged. To date, New York State does not require schools to have suicide prevention policies. And so you can see on the sheet here, there's no laws in place for any of this, which in most states there are. Like I said, no suicide prevention, intervention and post-vention policies and programming. Student education on suicide prevention, again, no laws. So, legislation. I thought this is important to look at. So, we'll start with this one. New York State Assembly bill. This is the bill. I know it's hard to see. You can't really see it on this one. But basically, it enacts the Student Suicide Prevention Act, requiring a governing board or body of every local educational agency serving students in grades 7 to 12 to adopt policies, procedures, and guidelines on student suicide prevention, intervention, and post-prevention for students in such grades. This was introduced in the beginning of 2021. It is right now in the committee. And then going to the other slide here. This is the same bill, basically. Requiring local educational agencies to produce policies, procedures, and guidelines which direct teachers and other school employees how to respond to students who have demonstrated suicidal thoughts or intentions. This was introduced in 2019. It's been sitting in the committee since it was reincarnated into another bill. But yeah, they're sitting there currently.
Do we know why?
We don't know why. No, they're just not.
Somebody put it down. They were like, yeah, we'll do this later.
You can
And
go
then-
on the site, if you like just Google like this name, you can go on there and you can see the action it's been taking, and it just
Every
lists-
2 years it comes back up.
Yeah,
And has to
So,
go back.
yeah, it has to come back once it's introduced, so they just keep,
Yep.
Shoving it, until hopefully one day it'll get passed.
yeah. And so my plan, is basically a mission to prevent youth suicide attempts and save lives. So we're going to adopt a policy related to suicide prevention training at South Park High School. Just like the laws enacted in other states, the policy will mandate annual suicide prevention training for all school personnel. And so the training will occur, if they're implement it, will be on a scheduled in-service day or during a faculty meeting. It would last 2 hours. Staff would be required to submit a copy of their license or certification as proof of completion. Progress, you would monitor it through the pre and post surveys. Examples of things like the American Foundation of Suicide Prevention actually has one on their site. It's all electronic, so you can get the data that way. But the measures, for instance, would be having a greater understanding of mental disorders and other risk factors for teen suicide, or how they have an understanding of how they can refer at-risk students for help. The members of the team who would promote the business plan, who would support, would be crucial. Obviously, school nurses, counselors. And then after gathering the data at the site, the scope would obviously grow, and then you can implement it at other schools. And then from there, it could be used to support implementation of legislation. So, there are 4 core programs: QPR Institute, Gatekeeper Training, SPTS, Making Education Partners in Youth Suicide Prevention. They're either offered online or in person. And then I listed some of the topics here, which I won't go into, but again, it's like how to question, persuade, or refer someone who may be suicidal, the warning signs, causes of suicide, how to help someone in crisis. This is through the American Foundation of Suicide Prevention. I went to a walk 2 weeks ago, actually, and talked with the director, and we talked about the programs. And they have 2 different ones: Science Matter Early Detection, and then More Than Sad. And so, again, offered online. It can also be delivered in person, virtually. And one of her struggles is trying to get these programs into the school system. It's like, in what ways might I, type of a thing. So yeah, she's really struggling right now, which would be a great contact for you, Sherry. So I have her contact information for you. But yeah,
In here?
I don't know if I put in your folder, but that's one of her struggles right now. She's brand new to the foundation, and they're also trying to integrate it into actually emergency room departments. A lot of people are not being assessed for this, and she said a lot of people are, paying for the system. So, funding and competition. So obviously, I pulled a letter from February of this year on the budget process, which I'm sure you're familiar with, sure. It's a New York State letter, though. So right now we have operational challenges due to the continuing impact of the COVID-19 crisis. So some of these operational challenges that they state, addressing student attendance challenges, social and emotional needs, it's stated right in the letter, right? And then in the executive budget proposal, supplemental funding was granted, so that is an added bonus. Also, the American Rescue Plan signed budget adopted by the New York State Legislature, increase in state aid, and commitment to phase in foundation aid. With that, there are, of course, the internal sources of competition for funding dollars. So I pulled out South Park High School's 2022-23 school-based budget workbook. don't know, have you seen these before, Sherry? No? So there's a website you can access every single state and school budget. It lists everything out here. Here's their budget, this is their enrollment, this is how much they do per student. 24 departments are listed, 114 full-time employees. And this is what is allocated to professional and curriculum development, right here, which really isn't a lot, if you think about it, how many full-time employees they have. So again, that's an internal competition with all these departments listed here. I know it's really small to see, but yes. So, the gatekeeper training, I listed some of just the bulk pricing on up here, because it can be, considered a weakness, obviously. But they do have bulk pricing, again, it's $14.95 a person, and you're gonna get the certification, the license for this. Also this one, the SPTS, this is just made possible through donations, so there is no cost. American Foundation for Suicide Prevention, again, that's bulk pricing, you'll be granting $15, of course, for that. So, a school's greatest prevention resource is having staff who have been educated and have an awareness of youth suicide. Research has shown that youth struggling with suicidality do not seek help from adults and they go unidentified. So, poor mental health can inevitably result in the negative outcomes, can lead to illicit substance use, social isolation, delinquent behaviors, pregnancy, absences, or youth dropping out of school entirely, which is what South Park High School has been doing for many years. By adopting a policy on suicide prevention training, more at-risk students will now be identified. They're going to be referred for evaluation and also linked to the appropriate resources and services. It will therefore promote the health and the well-being of youth in the community, reduce suicide attempts, and ultimately save lives. So, the leadership connections on this, we all know that the work of a leader is change, and so all change requires that leaders seek out ways to make things better, to grow and improve and innovate. Of course, Reiner, Kusinos, and Posner gotta challenge the process, right? So you have to break those mindsets, progress step by step, break down those big problems into small, doable milestones, and proceed further. So now what? To conclude, I would say that suicide needs to be addressed. We know it's the third leading cause in the United States for the ages of 10 to 24, and the rate is continuing to rise. So, with only one clinical counselor at South Park High School, you have to implement a training policy. The most effective way to do that is to expand suicide prevention efforts in the school community. And depending upon the training program chosen, it may be of no cost to the school. And I think even if there was a cost, I think that it's quite minimal considering the impact that it can have on the students and ultimately the students. Yeah, anyone have any questions?
Why did you choose South Park?
That was one of the sites offered to us during our BSN program. There were only 3 sites at the time, and it was actually when the pandemic started. So with this, we assessed the community. We actually created an educational plan. So we were going to go into the high school, and I created a spin wheel, and I created a whole teaching plan with it for students. So that's a whole other aspect of it. So there's so many ways you can look at it as a lot of pieces of the puzzle, whether you do educating the students or you're training faculty or things like that. So it's just one approach to address it.
Sharing, there's information.
Yeah, you should send me that PowerPoint. Like the whole thing. Like, that would be great.
Why do you think I chose this topic, Sherry?
Oh, it's fantastic.
Send it to me too
Well-
for grading, but, well done. Thank you. It hurts my heart. I had a nephew who committed suicide about 8 years ago. And
I'm
he
sorry.
was 40 years old. And it was, well, there were issues, but there's how that affects families is just incredible.
And, people just don't think to, do windshield survey to look around the community to get to the root of the problem. Like, why is this happening? Why are these students dropping out? Why do they resort to the drug use and the alcohol and the suicide? Is that you have to look at all those things. You gotta have to get to the root.
And
You
the
have-
little signs, the little
Yeah.
signs.
Mhm. Yeah.
Yeah, my father taught at Bishop Time for a lot of years, so. But anyway, guys, thank you, Christine, very informative. Your friend over there, Sherry, needs your work.
For sure.
Ladies, are there any questions you have for me at this time?
No, I just have to turn in my
We're gonna
final
turn off
paper.
the button to the, up. Here I come. To your right. It's the silver button that looks